Fellow colleagues, compatriots, and military health community members at large, good day. At dawn on the 1st of January 2020, we all had our dreams, plans, aspirations, and hopes for the year, unconscious of the fact that those would be completely changed one way or the other, whether mildly, moderately, or severely by this global pandemic, COVID-19. I would like to extend my warmest season's greetings to all of you deployed internally and outside the borders of the Republic of South Africa as part of the UN Peace Support Mission. Military health care practitioners and to the health support personnel who have been in the forefront of a war against this pandemic that has affected so many of our soldiers' lives. This is supposed to be a festive season. However, like the rest of the world, we are still locked in the throes of a ravaging pandemic that has decimated lives and livelihoods of many of our soldiers. There is no doubt that this 2020 festive season is no ordinary festive season. As we reflect on the accomplishments and encounters of 2020, it is time to redirect our thoughts on fresh dreams, fresh possibilities, and fresh hopes for the future of our families, our military population, and ourselves as individuals. Even in the face of adversities, the festive season remains a time for the renewal of our collective resolve as a nation to unite behind the vision of a cohesive and a very inclusive military health community in pursuit of scientific solutions for our scientific health-related challenges that will ultimately give birth to peace, prosperity for our soldiers. As the South African Military Health Service, we are conscious and alive to the fact that we must find our common purpose in building a better military health community that will take care of all the soldiers and their immediate family members. As the SAMs, we are reminded and encouraged to reach out, lend a hand, and support those who are less fortunate in our military communities, especially those members who have been severely affected by accidents, HIV/AIDS, tuberculosis, and many other communicable diseases, since these are very much with us, irrespective of the presence of COVID-19. This has been the most difficult year and the season that our military healthcare practitioners are facing in the history of this country. Our country's healthcare system is under severe stress. The country is currently facing a resurgence of COVID-19, and the second wave has come with a new variant of the coronavirus. Scientists and officials have warned that the new variant carries a heavier viral load and appears to be more prevalent amongst the youth. The country has surpassed the 1 million mark of infected cases, and efforts are underway in place to curb the spread of this coronavirus. When we first heard of this virus, the reporting was about figures and numbers. Now, the reporting is more about quantified names and known names of our loved ones. It is in our homes, it is in our communities, it is in our workplaces where we are losing lives due to the virus. It is through our behavior then that we will see a definite change in the fight against coronavirus. To our health warriors, you are reminded that you were the first people to lift up your hands and sacrificed all to go to fetch our fellow South Africans from Wuhan in China in the beginning of March this year. This is the most trying time when you have to neglect the seasonal festivities and great moments of spending time with your families and opt to remain on the front lines of hospitals, of clinics, of sick bays in order to provide health care to the Defence Force members and their dependents. Our frontline healthcare providers must continue to remain on high alert, though, for this vicious virus has taken various forms declared by the epidemiologists. Positive cases are increasing exponentially. It is now imperative to remain in defensive positions, like well-armed soldiers in their trenches throughout this festive season. In essence, our ammunition really against this pandemic is the wearing of masks, social distancing, washing of hands, sanitizing, obeying the commands and instructions from doctors, nurses, and also epidemiologists. Your sacrifice and commitment throughout the recent operation of Opnotlela has not gone unnoticed. To the military community, this year has proven to be the toughest year this country and the world has ever seen in recent history. The resurgence in cases of coronavirus has been driven by more gatherings over and cases in this festive season, as well as more transmissible variant of the virus that has been reported by the scientists, as I have said before. The festive season under these circumstances has become very intricate. It is surely not business as usual. This calls for a high level of discipline and sacrifice. The fight against coronavirus demands consistency, not complacency. History will surely judge us unforgivably if we neglect the precautionary measures set out by the national government and disobey the World Health Organization's protocols. Collaborative work between different militaries in the research and development of the vaccine is well underway. Due to the coordinated work between the Minister of Defense and Military Veterans and the Minister of Health, we have found it prudent to knock at the door of the national health system, to be amongst the first recipients of the distribution of the vaccine when it hits the shores of our beautiful republic. Isolate in order to disrupt the transmission chain of the coronavirus. Mass quarantine and isolation facilities for the use by the military community have been made available. I urge you to protect your loved ones. Celebrations in masses are outdated until we defeat this invisible enemy. I would like to reassure you that the South African Military Health Service is working around the clock to hinder and inhibit this fast advancing destructive invisible enemy. On this day, our hearts and best wishes also go to all those of our soldiers who will not have the possibility to celebrate the crack of the new year because of ill health and other problems. On behalf of the South African Military Health Services, as we wind down this unprecedented year, I deem it prudent to dedicate this special moment to wish you all of you a successful and a happy new year. I thank you.